You're standing at the kitchen counter, and there's a jar in your hand. Pickles, maybe, or the good jam your daughter sent for your birthday. You grip it the way you have 10,000 times before, wrist twisting, knuckles pressing white, except this time it doesn't give. You reset your grip, try the towel trick, run it under hot water the way your mother used to, still nothing. You laugh it off. Bad lid, you tell yourself. Set it down and open a different jar instead. But your hands have been trying to tell you something for months, and tonight you're finally going to listen. It's not a bad lid, and it's not just getting older. It's a specific, measurable shift happening in your hands and feet right now, one that quietly decides whether you're still opening your own jars, buttoning your own shirts, and driving yourself to see your grandkids 5 years from now. I'm Dr. Thomas Hayes. For the past many years, I worked almost exclusively with adults over 60, helping them keep the small, unglamorous hand and foot abilities that add up to a whole independent life. The jar opening, the shirt buttoning, the walking to the mailbox without thinking about it kind of independence. My only goal tonight is to help you catch the warning signs early enough that you never have to give any of that up. Tonight, I'm walking you through 8 warning signs, 8, and I want you to actually count them with me, that your hands and feet are quietly losing the strength and sensation that keeps you independent. Warning sign number 6 is the one almost nobody connects to their feet at all, and it's usually the very first one that shows up. Before we get into it, this video is for educational purposes only. It's not a substitute for an evaluation from your doctor, your podiatrist, or an occupational therapist, and you should always talk to a licensed professional before starting any new exercise, changing any medication, or treating a wound on your foot yourself. Now, a quick question before we start. Type your age and the state or country you're watching from in the comments. I read every single one, and I want to know who's in this room with me tonight. Before we start the list, I want to give you one number to hold on to, because I'm going to come back to it twice more tonight. It's the 15-second jar test. Right now, if you're not driving, grip the tightest jar lid in your kitchen and time how long it takes you to open it, or admit that you can't. 15 seconds. That's roughly how long a healthy, coordinated hand should need. Past that, and your hand isn't struggling because the lid is stuck. It's struggling because something underneath your skin has already started to change. It's a soreness or stiffness right in the soft web between your thumb and index finger, especially when you're twisting, pinching, or gripping something tight. Jar lids, car keys, a stubborn button. Here's why it happens. Picture the joint at the very base of your thumb like a door hinge that's swung open a million times. For years, it moves smoothly, quietly, without you ever thinking about it. But eventually, the cushioning inside that hinge wears thin, and metal starts grinding faintly against metal every time the door opens. That's what's happening at the base of your thumb. The cartilage cushioning that joint is wearing down, so every twist creates friction that wasn't there before. Research has consistently pointed to this exact joint as one of the very first places arthritis shows up in the entire hand, often years before it appears anywhere else in the body. And this is exactly the joint behind that 15-second jar test from a minute ago. When that test fails, it's very often this specific joint that's struggling, not your overall strength. The fix is simple. Gentle isometric thumb presses against your fingertips, a soft thumb brace at night if it's aching, and a conversation with a hand therapist if it doesn't ease up in a few weeks. Here's what most people get wrong. They push through the pain and just switch everything to their other hand instead of addressing the joint itself, which doesn't fix anything. It just moves the same problem down the road a few years. You go to pick up a coin, a pill, or a shirt button off a flat counter, and your fingers just can't quite pinch down on it. They slide right past. Your grip on a coffee mug still feels strong, but this tiny, precise pinch has quietly disappeared. That's because picking up something small depends on a handful of tiny muscles deep inside your hand, all firing together with perfect timing. Think of a sound engineer with dozens of small dials that all need to line up exactly right, or the whole mix goes off. If even 2 or 3 of those small internal dials slow down, your fine pinch falls apart, even though your overall grip still feels fine. Occupational therapists often see this pattern show up before grip strength itself declines noticeably, which is exactly why it gets missed on a standard strength test at the doctor's office. The fix? Therapy putty or clay pinching exercises for a few minutes a day, and practicing picking up small objects on purpose, not just when you have to. Here's what most people get wrong. They blame their eyesight instead of their hands and spend money on new glasses when the real issue was never about seeing the coin. Your hands start to ache or cramp gripping a steering wheel, or even just holding your phone somewhere around the 10-minute mark, and it's noticeably worse first thing in the morning. Think of your finger joints like a rusty gate hinge overnight. While you sleep, a little inflammatory fluid pools around the joint, the same way rust and moisture settle into that hinge overnight, and it takes several minutes of movement to loosen back up. Many rheumatology sources describe morning stiffness that eases within about 30 minutes as a hallmark of ordinary wear and tear arthritis, while stiffness that drags on much longer than that is worth specifically mentioning to your doctor. The fix? Run your hands under warm water and do a few gentle wrist and finger circles before you ever start the car. Here's what most people get wrong. They assume all morning stiffness is just normal aging and never mention how long it actually lasts, when the duration is the single most useful clue for a doctor. You put your socks on and you genuinely can't feel the seam, the texture, the little bumps under your toes the way you used to. It's like your feet are wearing thin gloves instead of bare skin. Here's why. The nerves running to your feet are the longest wires in your entire body's electrical system, stretching all the way from your spine down to your toes. And the longest wires are always the first to show wear, the same way a fraying extension cord starts flickering at the far end before it fails anywhere else. This kind of numbness, called peripheral neuropathy, has been linked most strongly to diabetes and prediabetes, but it can also show up with vitamin B12 deficiency, certain medications, or years of unmanaged blood sugar swings. A lot of adults with type 2 diabetes eventually develop some degree of this kind of nerve change, which is part of why it's worth taking seriously even before it feels like a big problem. The fix? Run your fingers along your own sock seams once a week as a deliberate check, and do a nightly visual foot check with a hand mirror if bending down is hard. Here's what most people get wrong. They wait for their feet to hurt before checking them, when the entire danger of this warning sign is the absence of pain. This one follows directly from the last one. A blister, a cut, or a pressure sore forms somewhere on your foot, and you don't notice it, not for days, sometimes not for weeks, because the pain that would normally announce it never fires. Think of pain like a smoke detector in your house. Once nerve damage quiets that detector, small fires can burn for a surprisingly long time before anyone in the house even smells smoke. Podiatry guidance consistently points to daily foot checks as one of the single most effective ways to catch a problem while it's still small, especially once sensation has started to fade. The fix? Check the bottoms and sides of both feet every night. Wear properly fitted shoes and never walk barefoot, even at home. Here's what most people get wrong. They only think to check their feet once something already hurts, which with this warning sign specifically might be too late to matter. This is the one I promised you at the start, the one almost nobody connects to their feet, the first step stab. You take your very first steps out of bed in the morning, and there's a sharp stabbing pain right in your heel, one that eases off within a few minutes of walking around. Picture the tissue along the bottom of your foot like a bowstring. Overnight, while your foot rests, that bowstring tightens back up slightly. Then your very first steps yank it taut again suddenly before it's had a chance to warm up, like snapping a rubber band that went a little stiff overnight instead of stretching it gently first. This is one of the most common causes of heel pain in adults over 50, and it tends to respond well to a few minutes of calf and arch stretching before you even swing your feet onto the floor. The fix? Stretch first, stand second, and wear supportive shoes rather than flat, unsupported slippers, especially early in the day. Here's what most people get wrong. They walk straight onto hard floors barefoot first thing in the morning, which is exactly the moment that tissue is least ready to take any weight at all. Quick myth-busting break, because I hear this one constantly. Myth: numbness or tingling in your feet is just poor circulation from sitting too much. Fact: while circulation problems are real and worth checking too, that specific numb, walking on cardboard feeling is far more often about damaged nerve signals than blocked blood flow. Treating it like a circulation problem alone, with just leg elevation or compression socks, can mean months go by before the actual nerve issue ever gets addressed. Then there's Diane, 68, retired school teacher, type 2 diabetes for 11 years, and, in her own words, the most careful person I know. She stepped on a small stone in her garden shoe back in July, didn't feel it happen, didn't even see it until nearly 3 weeks later when the skin around it had gone red and warm to the touch. What should have been a 2-day inconvenience turned into a 6-week wound care process because the nerve damage that numbed her pain also delayed her from ever knowing there was anything there to treat in the first place. Diane didn't do anything wrong. Her feet simply stopped sending the warning signal that most of us take completely for granted. So tell me, type 1 in the comments if you already do a nightly foot check like this, or type 2 if tonight is the first time you've even thought about it. I want to see how many of us are actually starting from the same place. Your handwriting has gotten noticeably smaller, shakier, or more effortful. A birthday card or a grocery list now takes real concentration and time it never used to. Handwriting is one of the most complex fine motor tasks your hands ever perform. Dozens of tiny joints and muscles coordinating in fractions of a second, the way a full orchestra needs every single instrument in tune at once. If even a couple of finger joints stiffen or a couple of nerve signals slow down slightly, the whole performance changes, even though no single part feels dramatically wrong on its own. Hand therapists often use changes in handwriting size and pressure as one of the earliest, most reliable clues of fine motor decline, sometimes appearing before someone consciously notices anything different in their grip at all. The fix? Keep a short, honest daily journal entry, even just one line, so you can actually compare your own handwriting over time, and try a few minutes of marble pickup or putty exercises to keep those small muscles active. Here's what most people get wrong. They blame it entirely on just shaky hands and never mention it to a doctor because it doesn't feel like a real medical symptom. You drop things, a cup, your keys, the remote, more than once or twice in a single week, with no obvious reason why. Here's the thing about grip strength. It functions almost like a dashboard warning light for your entire body. Your hand is small and easy to measure, but the nerve and muscle systems that control it are wired into the very same broader systems that control your balance and your overall strength. So when your hand's signal weakens, it's very often reflecting a change happening more broadly in the body, the same way one small dashboard light can point to a problem in a much bigger system than just that one part. This is actually one of the most heavily studied warning signs in aging research. Weaker grip strength has been repeatedly linked in scientific literature to a higher overall risk of falls and a faster loss of independence in the years that follow. Regarding the specific increase in fall risk associated with declining grip strength in adults over 65, that's exactly why it earns the final spot on this list instead of the first. The fix? Track your drops honestly for 1 week without judging yourself for it. If it's more than twice, bring that specific number to your next doctor's visit and ask about a formal grip strength test. Here's what most people get wrong. They file dropped objects under clumsiness instead of recognizing it as data their own body is handing them, completely free of charge. So here's what you actually do with all of this. Not a diagnosis, a conversation starter. The next time you see your doctor, your podiatrist, or a hand therapist, bring these 4 questions with you. 1. Can we do a formal grip strength test, and can we track it over time instead of just once? 2. Based on my sock test and my nightly foot checks, do you see any early signs of reduced sensation we should be monitoring? 3. Is my morning stiffness typical wear and tear, or does the duration suggest something else worth looking into? And 4, this is the one people forget, are any of my current medications known to affect nerve sensation or hand strength? Sometimes the honest answer is a medication side effect nobody ever connected to the hands or feet at all. And remember that 15-second jar test from the start of tonight's video? Do it again next month, not to scare yourself, just to know in real numbers whether things are staying steady or starting to change. That's the whole point of tonight, not fear, information. Think about what your hands and feet actually do for you every single day, so quietly you barely notice. Think about the birthday cards you write out by hand, the grandkids you still buckle into car seats yourself, the walk to the mailbox you take without a second thought, the drive to go see the people you love. Imagine catching one of these 8 signs early enough that none of that ever has to change. Imagine independence not as something you're fighting to hold on to, but as something you actively protected on purpose starting tonight. If even one of these 8 signs sounded familiar, tell me which one in the comments, not a number this time. Tell me the actual story behind it. And if this video helped you, the most useful thing you can do is send it to the one person in your life who's been quietly avoiding their own jar test, a parent, a spouse, an older sibling. While you're at it, subscribing helps this channel keep making videos like this one every week. Last thing, and it matters, everything in this video is educational, not a diagnosis or a treatment plan. Please talk to your doctor, your podiatrist, or an occupational therapist about any of these signs before making changes to your routine, your medication, or how you're treating a wound yourself, especially anything involving your feet, since that's exactly where things can go wrong the fastest. Take care of those hands. They've earned it.